Okay, so today we have a guest, David Friede, Vice President of Strategy at wisepatientAI. David brings over a decade of experience in the healthcare sector with expertise spanning cybersecurity and information technology. In the past 5 years, he has focused on electronic healthcare record interoperability, patients, and accessing with comprehending their medical information from various providers. Anyway, as a caregiver for both of his parents, he has a personal understanding of the challenges patients have faced while navigating the intricate medical system. So, with no any further ado, I'm going to present David. Go ahead, David.
Hey, thank you, Kaz. Really happy to be here. David Friede, Wise Patient AI is our company. As you mentioned, I've had over 10 years experience in the healthcare industry. Most recently out of necessity, I am what everybody calls a sandwich. So that means that I am taking care of myself. I was taking care of my kids, and then now more so taking care of aging parents. And basically, kind of what we're finding is the healthcare system isn't really getting better, and people can't improve the level of care that they're receiving unless they understand their care or understand their health and their medical records. And so today's session is about your rights and responsibility to get your medical records, to understand them, to become active participants in your care. The law is on your side. I'm here to show you and kind of give you the tools to start doing that. And then help as you're taking care of somebody or somebody that's taking care of you, help them in this process because it's very difficult and time consuming. So I'm going to give you some tools today to help you do that, and then stress the importance of you taking action and being responsible. So with that, if it's okay if I share my screen, and hopefully we've got it where we need to go. All right, hopefully everybody can see my screen now.
Yeah.
The title of the presentation is to improve your care by getting to know your healthcare records. Does everybody know this? That despite having some of the best trained physicians in the world, the United States ranks last in healthcare among high-income countries. We have some of the best education, some of the best hospitals, the best equipment, the best nurses, but yet we rank last. And there's many reasons for this, including how convoluted and complicated our system is. Lots of different billers, lots of different providers, the way we administer care, government's involvement in the care. These are things that have been trying to be fixed for over 50 years, and they aren't that much better than they were back then. So if we start looking at ways, how can you improve the care you're receiving? You personally can become better educated. You can have all of your information with you and make the process as efficient as it possibly can. What can you do to help improve the level of care? Empowering yourself with information. By understanding your information, by having ensured that it's correct, by sharing it with caregivers and spouses, you can participate in your care and treatment plans and make sure that all of your information is correct. Become your own healthcare advocate. I'm not sure if people are realizing that the healthcare system is becoming more and more burdened. Doctors have less time to spend with you. As you age, and I'm witnessing this myself, more things happen. You see more doctors, you take more medicines, accidents happen, and the system is not going to advocate for yourself. You have to. Get to know your medical records. This is one thing you can do. Make sure you know who your providers are, what information is in your records, and then understand what's included in them. That can help you understand your conditions, what medications you're taking, and why, so that you have an accurate understanding of your health. Each time you go to your provider, it's recorded in your personal medical record, which follows you throughout your life. This medical record keeps going. Unfortunately, if you move or sometimes you go to a different provider, it doesn't always keep track of you with you. So again, that's up to you to make sure that you've got your records. They're correct. They're following you around, especially when you move. Um, there's a wealth of information included in these records, and it's important to know what is in them. For me personally, when I first got started with this company, I was just amazed at everything that's in there. You get to see your current test results. You can see over time what your weight has been. And really interesting is to see the notes, what the doctors write about you. I did a presentation at Senior Planet yesterday, and we were discussing these notes, and the doctor had written in there something that wasn't true and discussed with the patient. If she wouldn't have noticed that, this would have been in her record forever. So you need to know what the doctors are saying about you. You need to know what your records are saying about you, and discuss with your doctors and nurses to make sure that everything that they've discussed with you is what's reflected in your records. So your records contain a wealth of information about you. What conditions you have been diagnosed with over time, what treatment plans you have been prescribed, what medications you are taking. Again, the physician notes on your last visit, lab results, and imaging for x-rays. So kind of going through these, what conditions you have been diagnosed with. Doctors and nurses are humans. And the medical system is very complex with lots of codes and lots of room for someone to put in a wrong number or to say something that wasn't entirely accurate. Um, so it's vital to go in there and say, okay, yes, this is the condition that I discussed with my physician, and they have diagnosed me with this. What treatment plans you have been prescribed. Again, in today's busy, complex system with people trying to rush through appointments, they may prescribe a treatment plan that they've already prescribed for you that didn't work. If you know what plans have been prescribed, what has worked, what's not, it saves a lot of time and repetitiveness and can get you moving faster towards getting healthy. What medications you are taking. Okay, this one is particularly interesting, and we will go into more depth on it here in a minute. But in your medical records, it reflects every prescription that you've been prescribed. And so if we think about that, your medical record's going to come over and it may have 20. I have 15. You get a sinus infection and they give you an antibiotic. Well, I just took it for that little bit, but it's still in my record. So a doctor looks at this list and they've got just a little bit of time. And you spend a lot of that time going through what medications you are currently taking. You can save a lot of time, help the doctor and your pharmacist make a better decision if you just have the current list. These are what I'm taking right now. Again, the physician is going to write down their notes on your last visit. Maybe they transcribed the note wrong. Maybe they put something in there that you didn't discuss. I just find it profoundly interesting to read what they wrote down about my visit. Your lab results, it's always good to have looked at those. Obviously, we're not physicians. Most of you probably aren't physicians either. But your lab results will give you trends. You can see how your cholesterol is doing, your glucose levels, whatever tests they order. It's good to have those on hand because the most valuable lab results are longitudinal. You may have a one-time test that's out of normal, but they like to look at it over time. Has your cholesterol always been the same? Is it just going up recently? So the more longitudinal information they can have, the better they can make a treatment plan for you. Again, I don't know how many physicians we have on here, but your imaging for x-rays is often in there. We're not going to be the ones looking at them. You aren't going to be the ones looking at them. But having them on hand is crucial if you have to go see another specialist. If you have to go see an orthopedic surgeon and you've already had the x-rays, those x-rays can be shared instead of you having to go and do it again. It saves you time, it saves the system money, and of course, if you're having to do a copay, you know, why have it done again when you've already had it done? Okay, your medical record is created by your provider, and the information is entered by doctors, nurses, and assistants. They enter information such as your current vitals and weight. We all know every time we go in, they do your blood pressure, your oxygen, and weigh you. Um, the next one is reason for visit, and often in the notes, you'll see it as chief complaint. Um, most of the time, hopefully, this is a wellness visit. But if you're going in because you're tired or you haven't been feeling well or your stomach is upset, that's what they will list as the chief complaint, the reason for visit. The doctor notes concerning your visit, you may talk to the doctor for 10 or 15 minutes and you're just going back and forth and there's a dialogue. They're not going to transcribe every word that you've talked about. They are going to put in their key points. Again, reviewing this and saying, well, I mentioned that I'm also kind of having dizziness. And if they didn't record that in there, well, that was one of the reasons you were there, and that was one of the reasons you came to see the doctor. Again, they're going to have all of your prescriptions in there. It's going to be that big list. You're going to have the review of lab results. Hopefully, if you get labs ordered, your doctor is going to sit there with you and go through what they mean. And then the treatment plan prescribed. Again, for you to understand why they prescribed that plan, to keep track of if you're adhering to the plan. Um, all of this helps improve the system because if you go and they say, we're going to try this out, we're going to do PT, we want you to do this, and it kind of gets better for a little bit, but then it comes back later. You know, they may have forgotten that they prescribed this. Another physician could have prescribed it, and they can prescribe it again. And all this just takes time. We know that that treatment plan didn't work. So the more you can understand, yes, I did physical therapy and it did not help my knees, so I need to go to an orthopedic person. Again, we are not becoming medical doctors. We're not saying, you know, use the Dr. Google and figure out how to do it. The doctors are the best trained. They know what to do, but they have to have all the information to make the best decisions. Okay, how can I access my medical records? People do not know this, and this is something that's very refreshing in today's political environment. But the 21st Century Cures Act is a law that went into effect in 2023 that requires providers to give an electronic copy of records to patients. Now, the crazy thing about this law is I think it went through 3 or 4 presidents. And was finally put into effect in 2023, but it's had bipartisan support where everybody finally agreed that, you know what, the patient owns the medical record. The doctors create them, they make their plans and prescriptions, but the patient is the one who actually owns their record. And this law went into effect, and it comes with $1 million fine for every occurrence that a physician doesn't provide this to patients. Obviously, that's a heavy fine and it's per incident. It's not enforced a lot because most providers realize that it's out there and they've already set up their portals and they providing electronic copy of records to patients. But you as a patient should just know that it's your right. And if you're having difficulty getting records, the government has made a website. It's very easy to get to. We can send you a link to it. But basically, you just put the provider in there, and the reason you can't get your information, it's called information blocking. And then they are required, they will get a notice, and then they will participate quickly after that. Most providers now offer a patient portal. And this allows you to access your records from your phone or your computer. So, and I like to share a lot of personal stories. I have a dermatologist and Flatirons Dermatology, if anybody needs a recommendation here in Colorado. But once I made an appointment and signed up with them, I went to their website and there's usually a tab at the top that says for patients and it's patient portal. And you enter that information in there. It'll ask for your date of birth. It'll get some credentials for you. And then you have direct access to your records from that provider. My PCP, primary care doctor, doesn't have access to that information, but I do, and I have those records, so I can have them with me whenever I go visit any other physician. So whenever you finish up an appointment with the physician, ask for instructions on how to receive your records or how to access the portal. The doctor is probably not the person to ask, but when you're checking out, the people at the desk definitely have experience doing this. And if you have your phone, they can probably help you get set up right while you're there. All right. There are over 7,000 different patient portals, but they are all essentially the same. Okay, and I've given you 3 different login screens just as examples. But in essence, it is just like signing up for online banking. It's like signing up for an account for to review your insurance. Same process. You'll see over here, and I apologize because it's very small for me to try and fit these on here. But this first one is Medicare.gov. They've already set this up for you. All right. So you're going to go over here and it says create an account now. That is very easy. You need your Medicare card, your Medicare number. They're going to ask you date of birth and a few other questions, and bam, you've got an account with Medicare.gov. What they ask you to do next is set up your account, your username, and your password. Again, just like any other account. So this is what you would see, and I would encourage everybody that's on this call to go and do this first step, because now you see what people are billing Medicare for, the services that you're being provided and billed for. And Medicare wants you to have this information because it helps them ensure that they're not being defrauded. It makes sure that you're receiving not duplicate tests. They really want you to be involved with your records and your care. Okay, so the next one, Aetna. I'm not sure how many people have Aetna, and it's just a big, can be a Medicare Advantage plan, or it could be a direct insurance through Aetna. But as you'll see, essentially, it's the same thing. Sign into your account. You need your username and your password. And again, essentially, what they're going to ask you is to set up an account. What is your member number? They'll ask you a few other questions to make sure that it's you. You set up your username and your password, and now you have access to all of the information related to your health that Aetna keeps on you. The third one over here is UC Health. All right, and I put that on there because I live in Colorado, and UC Health is one of our biggest healthcare systems. Again, same exact thing. My Health Connection username and my password. And now every time I go to a provider within the UC Health system, my records, although they may not be sharing them between each provider, I have all of them in one place. So now if I go to a doctor and they say, hey, what about this? I don't see it in your record. I have my record and I say, yes, this is in here. This is what I was diagnosed with. This is what they prescribed. So you can't go into the system thinking, oh, my primary care person has access to all this information. They are going to know exactly what's going on with me. They don't always. So it's up to you to go in and say, this is all my information. Here it is. Now we can get moving towards getting me healthy. All right. So you can request your records in several different ways. All right, so your provider has a set of your medical records. Sometimes they have from other providers as well, especially if they're in the same system, like that UC Health example I just used. However, in many cases, they have to request that the records be sent over. Okay, now if you just think about what I just said, in many cases, they have to request the records be sent over. So what can happen is you can be going to an appointment and you can talk to the doctor and someone forgot to do that in advance. And so you're basically at the doctor having a nice conversation, but they have no idea what your records from the other provider say. And I don't know how many of you have had this happen and they say, oh, well, okay, we need to request your records and then we'll schedule a follow-up appointment. You've just wasted 2 weeks of time. Now you have to go do another appointment. if you always have your information with you, you can share it right there with them, shortcut the process and help the doctor make a better, timelier decision on your behalf. Like the examples I showed you with Medicare.gov and Aetna, your insurance company has a complete set of records related to the billing that was submitted for your care. Okay. You know, this is so important. Healthcare fraud was 300 billion last year. And so if you step back and think about that, 300 billion, and a lot of it came out of Medicare. And what essentially happens is cyber criminals will get your information. You will never know this, but they will bill Medicare for a cane, for transportation services, for a walker, for wound supplies. No one knows that this didn't happen except you. And so once you get in there and start looking at the claims that they've paid, you can ensure, yes, this happened to me. I did do this appointment. I did see this doctor, and this is what we came up with. I definitely didn't order a cane or receive one. So now you're participating in the process. Sometimes that money can be used against you for your benefits, and people don't even know until they've exhausted them. So it's up to you. People reconcile their checking accounts. They look at their credit card statements. They need to look at their health records as well. It's very important. Medicare, Medicaid, and the VA keep a set of records that you can access directly through their portals. So you have a couple options. If you go to Medicare.gov, we just showed you how to do that. Medicaid is by state. States are becoming more and more active in same sort of thing, electronic access for their patients and recipients. And the VA. So my company started 5 years ago, and we were kind of right in the thick of this new transformation of getting information in the hands of patients. And Medicare actually reached out to us and they said, hey, we have this huge amount of information on all these people, but we have no way of getting it to them. So they kind of worked with us, the collaboration, and that's when our app was born. Medicare connects with us. So now we're a direct portal. We connect to their servers in Virginia securely, and we are a trusted partner for you to access your information from them. Subsequently, the VA saw what we were doing with Medicare, and they said, hey, we've got this problem of all this information that we can't get to our veterans. So we did the same process. So now through our free app, you can go to Medicare and the VA, and I'll throw in there that you saw that you can directly go into Medicare, and VA members know that you can use 4 sets of different credentials to access your portal. But you need to take advantage of that to go into those portals and look at your information to ensure that it's correct. Again, and also help, make sure you get the best care that you possibly can. Lab companies also often have portals like LabCorp where you can view your results directly. And I've got a lot of kind of case study stories about this. This one was that my dad had a test to determine if he had rheumatoid arthritis. He was showing symptoms of having that. And his doctor said, okay, great, we're going to order this blood work. And then we'll revisit this in 2 weeks when we get back together. Well, I'm his advocate and I have access to all of his information. And when the labs came out, I went through them and reviewed them. Again, I am not a doctor. I am not going to make medical advice, but you could see from the labs, they give you indicators like this was normal, this was normal, this was normal. There were none of the blood markers for his condition that they thought that he may have. He did more research on it, and then the doctor called me and said, hey, it doesn't look like your dad has this, but we think he could have this, so we'd like to start him on a treatment plan. And then in 2 weeks, we'll see if that had helped or not. So essentially, we've ruled out something that could have been causing his problem. And then we've also started him out on a proposed treatment plan to see if by the time he gets to that appointment, it's had any effect on him. If we wouldn't have taken those steps, We would still be waiting for his appointment next week, just starting the proposed treatment plan then. Now we've made it to where when he gets there, they've tried it out and he can decide to extend it. Or definitely maybe have to try something different. Okay, why is it important to have your healthcare records? You need to learn more about your health so you're an informed patient. This helps your provider make the best decisions for you. Again, back in the earlier days, and this even going back for me, we trusted our physicians implicitly to make the decisions about us. We weren't required to learn this terminology. We were just trusting that they were making the best decisions for us. We have some of the best doctors and nurses in the world. But with the way the healthcare system is today, they are having to see more patients. They are having less time to do that. There's so much more regulations around them. So if you're going in and you're asking them constant questions about what does this mean, about a past condition, about your medication, you're spending all of that time getting educated on your health instead of collaborating on a way to make it better. Again, you want to learn more about your health from trusted sources, but if you understand what your conditions and medications are, then you can help the doctor make the best decisions for you. Check your records for errors. People don't know this, but up to 70% of records can contain errors. And sometimes this can be very dangerous. Medical death due to medical not medical record error, due to medical errors is in the top 10 of causes of death in the United States. If they prescribe a medicine that has a counterindication, if someone is allergic to a medicine, if they make a misdiagnosis. Again, these mistakes happen, but you can help minimize them by looking at your records and making sure that what is in them is correct. The example that we use on our site and research that we done is there was a woman that was reported as pregnant on 2 sets of records, and she had never been pregnant. But that pregnancy thing was following her around and she didn't even know it. And that definitely affected what medicines they could be prescribed, the treatment plans that they were proposing. So it was on NBC News, like, this is why you need to make sure your records are correct. Okay, if there's any other reason that you're on this call with me or any other reason I'm motivating you to take action here is to reconcile your prescriptions. Okay, both your doctor and your pharmacist need to know what medications you are currently taking. As I mentioned earlier, in your medical records, it's going to have a list of all your medications going back in time. It can be a ton. Like I said, I had 15 or something, and I'm healthy. A lot of them are for acute situations, like an antibiotic for a sinus infection or something, but it's going to show up in that list. And when you go to the doctor and you spend time with the nurse and you're going through saying, are you still taking this? Are you still taking this? That is just eating up time. If you've gone and scratched out the ones that you took at one time and you're taking these 3 meds right now, that is invaluable to the doctor. It's invaluable to your pharmacist and definitely makes the whole process a lot more efficient and a lot safer for you. Okay, check your records for fraud. Everybody, we were talking about this before the call. With AI and people trying to get your accounts and sending texts and you getting emails, people are becoming more and more aware of it. This is much more subtle. They will do this all behind your back and you won't know anything's happening until, like my example earlier, where someone sold you a cane, someone got you transportation services, someone got you psychology appointments. You need to know what your medical records are saying about you and what is being billed for on your insurance. Okay, it's critical to have your records in case of emergency. I can't stress this enough either. It's a case study here. It's my next one. Recent admission into the emergency room for my mom. Okay, Saturday, June 14th, 2025. right? You guys think about that. That was just a little over a month ago. I received a call from the emergency department at UC Health. My mom was unconscious and unable to make a decision concerning a procedure. I was listed as her medical power of attorney and I approved the procedure. Again, she was unconscious. She was not coherent. And they called me and explained the procedure and why they wanted to do it. And I said, of course, we need to do that. Again, she was not coherent for about 5 days. And I was the one driving over there and talking to the doctor about current treatment plans, what her previous history was, what they are going to do in the future. And now she is back home. But it took a little village to make that happen. Her by herself, you're kind of at the mercy of the hospital. They can do tests, they can not do tests. You need to have an advocate because everybody has an accident, everybody may lose consciousness, and the EMT and hospital people are going to be making these decisions on your behalf, even though you may not want that to happen. So be prepared for emergencies and natural disasters. Obviously, I don't know how many of you saw that there was a tsunami warning for California and Hawaii. It seems like we don't know what's going to hit next. We had the terrible floods in Texas. We had the fires in California. Sometimes it can burn down a hospital. Other times you're displaced and you can't have access to your information. This is just like any other thing. You need to have that information with you. Um, Designate someone to make decisions for you in case you're not able. Again, cannot stress enough. You don't need someone to make decisions for you until you do. And a lot of times when you're in that position, it's not the time to find somebody. Find the person that you trust that can be by your side in case you're not able to help you get better. And again, make sure that your records are accurate and your medicine list is reconciled. That is, I want to say that that's your responsibility to make sure that what they're saying about you is what you're doing. Having a backup of your records is crucial. Again, cases of an emergency, having current records can be the difference between life or death. My example there is I met with a Flight for Life nurse, and she was telling me about someone they rescued in a car accident, and he was clotting. And so they were going to give him a blood thinner, but he had his records on his phone, thankfully, and he was already taking a blood thinner. So that literally could have been life or death. If they would have given that to him, he would have bled out and died. So when you have that information, just in case, it could make the difference. Sometimes providers are not able to get their records from other providers in a timely manner. Again, this is going back. We all assume that our information is just flowing to the providers and everybody knows what's going on. You would be so surprised and appalled to know that a lot of times no one knows what's going on. They don't even know who your provider is or how to get hold of them. It's your responsibility to have that all together for them, hand it to them, and let them do their job. Um, Not sure of how many people kind of live in the Midwest, but one of the largest hospitals lost access to their records system for over a month. This was Ascension Hospitals. They have 140 hospitals and 120 skilled nursing facilities. Doctors were flying blind when they were providing care. They did not know what the medical records said. The scariest thing about the whole process is these records were being held for ransom, and when they paid, they gave them access again. But in theory, they could have just erased them forever. And all of those records would have been gone. And now every patient in that system would have had to start from scratch in building a new health record. You all can imagine how just disconcerting that would be and how scary. So it is important to have your records on hand. If something like this happens and the system goes away, well, you have a copy for yourself. Again, natural disasters. I turned on the news and I'm like, what now? A tsunami? Um, Stuff is happening. Fires are happening. People have to evacuate, make different plans. Make sure you have your information on hand in case you're forced to evacuate. And last one on here is imperative to have your records accessible when you're traveling, especially when you're going overseas. if something happens to you and the doctors aren't necessarily speaking your language, or you get sick, you get a strep throat or sinus infection or something, if you have your medical information for you, it can make that whole process so much better and more effective and save your trip and keep you safe. Some other things to keep in mind about your health records. Okay, I will guarantee you that everybody that's on this call, and I will make that guarantee, has more than one health portal. It is important to have access to each one because they contain different information from the different providers. The reason I know this is I'm 58, and I have 6, and I'm a healthy guy. Um, but each one of those portals has a little different nugget of information about me that's all part of my big picture. The next thing is that health records are often written in medical jargon, which is difficult to understand. You need to research this information to become more educated. When a doctor tells somebody they have hyperlipidemia, the first thing that people freak out, oh my God, I have hyperlipidemia. Am I going to die? What's going to happen? It's high cholesterol. Medical terminology is written in medical terminology. It's less scary when you take it out of the terminology, understand, okay, high cholesterol, what is it? How do I treat it? Again, most seniors have taken multiple prescriptions in their lifetime. The records show all of them. Just go through and show the doctors exactly what you're taking now. And again, designate your caregivers in advance. You can't do it in arrears. You don't need one until you do, so it's best to be prepared. Okay, what are my choices in managing my records? Okay, one of the options is to access your different providers and keep a list of your different conditions and medications. The thing to note is if you're accessing these different portals, each record is going to probably say the same thing. There will be one thing that's different. If you go to an orthopedic surgeon, they are going to make notes about your joints while you're there, what your treatment plans are. But they're going to have the same thing about your conditions, medications. You're going to have just a lot of information that's duplicative, but you want to keep the thing that's specific to the provider that you are seeing. There's different healthcare apps out there. They're coming every day because people recognize the need. One Record is one of them that allows you to access your portals and they keep track of your login information. Apple Health is another one. Each one has different features and functionalities. The key is to finding one that's got the most connections possible, and gives you the best information in return. Once you've accessed your portals, there are many different resources such as Healthline, Mayo Clinic, Cleveland Clinic, heart.org. These are all organizations that house trusted sources of information about your conditions, medications, and treatments. So everybody, it's so easy to use Dr. Google. And we don't, we're not talking bad about Dr. Google, but a lot of times that information is grabbed from different resources and some aren't necessarily the best information. Um, and you don't know which one it is because it's all mixed in with everything else. So it's important to find the trusted sources for your specific conditions and medications and treatments, and use that as a resource as you're developing your care plan. Unfortunately, there's some smaller, older practices, physicians that have been around for a while, my PCP for 30 years, back when I lived in New Mexico, they still use paper charting. And it's kind of crazy to think about, but they're used to it and they're not going to change. They don't care about the fine. They're just in there to see their patients. And on those cases, you need to request a copy of your records and store them in a safe place. And what they would do, they will print out your records. They'll probably charge you for the copying amount, and then send them to you or have you come pick them up. Okay, and now here at the end, I get to say a little bit about wisepatientAI. This app was developed by our owners, and essentially it came out of our CEO and our CTO. They were taking care of his mom for 15 years. And over time, as she aged, she started getting more and more and more conditions. She started getting dementia. She had had multiple heart attacks. She needed to see a nephrologist for her lungs, or a pulmonologist. And so what they were finding is they were copying all these records and then all of her medications. And each time they went into a new doctor, they didn't have that information. And so they're carrying this giant folder and they have to go in and tell the doctors as much as they can, as fast as they can, um, especially when they had to go to the emergency room for her. So they started thinking, our chief technology officer worked for the Department of Defense in high-speed database information transfer. And so they began working on this process. And again, referring back to the Cures Act, um, they worked with us. We all worked together. Like, how can we use our technology to make the system better? And this is how the app came to be. This was 5 years ago. We got a lot of money in it. We have a lot of partners, big partners like CMS and the VA. And essentially, how can we help? Well, we allow you to connect all of your healthcare portals in one place. And essentially, what's going to happen is you're going to go through your Connect Records option and you're going to see that same login screen for CMS or your provider. And once you've logged into them, it becomes part of your app. Again, managing your entire family's health all in one app as a sandwich. It's hard to manage 2 kids and 2 parents in 4 states. You can imagine, I think we were over like 14 or 15 different portals. Having a patient snapshot on hand at all times. Everybody in this room has been to a doctor and filled out the clipboard, asking all this information. Sometimes it's hard to remember. Wise Patient will give you a snapshot where you can say right here, this is what's on it. You can use that to fill it out. And in some cases, you can even hand that to the doctor, and they'll scan it into your record. We also provide cash pricing and pharmacy locations. So sometimes your deductible may be higher than the price that you will pay if you had a coupon. So our app will say, here's a coupon for this at this Walgreens, which is 2 miles away. Keeping track of procedures and immunizations. Obviously, immunizations has become front and center since 2020. But it's important to know someone of my age should have the shingles shot and a booster. But the CDC puts out recommendations such as getting a pneumonia shot every year, things like that. So that's important to keep on track of what immunizations you have and what immunizations are recommended for you. Clinical notes and lab results all in the palm of your hand. Right there, you can use our app to go and look at what the doctor just said about you. Again, your lab results are included in there. So you can start keeping track and building that longitudinal record I was talking about. Instead of a one-time snapshot, it's over time, and you can see what your trends are. How else can we help? Our doctors, again, this is 5 years worth of work, have taken complex medical jargon and explained it to you in information you can understand. You are not going to see hyperlipidemia. You're not going to see myocardial infarction. You're not going to see a lot of these medical terms. You are going to see it in terms that you can understand. And then we have gone through and curated sources of information such as Mayo Clinic and Cleveland Clinic and heart.org and give you trusted resources. So you are always carrying around places you can research your health, trusted information, and understand what the doctor may be prescribing for you. The most current release, and it is still coming out, is our AI functionality. And using that from the palm of your hand, you can ask the app, what medications am I taking right now? What are my conditions? And more things are being built in every day. Why am I dizzy? And the app would look in your records. We've built this all for you inside of your records. Instead of going out and grabbing information from everywhere, the app may say, well, dizziness could be from your type 2 diabetes or this medicine that you're taking. So now you have something to talk to your doctor about. Could it be one of these 2 things? Other upcoming things are, when did I have knee surgery? When was that I had that mild heart attack? So you don't have to search through everything. It'll just tell you when this happened. Again, we give the option for you to save important documents like your medical power of attorney. We have a functionality where you can upload documents. I keep my insurance card on there, front and back. So when I go to a new physician, they can scan it or take the information. Again, like with my mom, I have her power of attorney on her phone and my phone. Um, so in case of an emergency or decision needs to be made, she's got it all right there in the palm of her hand. A lot of people take the time and effort to have these documents created, but they can't, they're located in a folder somewhere in a desk somewhere. And that's not where you need them when you need them. We're here to help you on your journey to better health. That's our job. We're trying to make this as easy as possible and for you to be able to really participate in your care and make the system better. So I think with that, I'm going to stop share.
Well, let's give David a big thank you for this
Yes.
wonderful presentation. My apologies,
Yes.
we don't have time. There's, as you expected, David, there's 30 more questions than we have time for.
It's a lot.
But thanks everybody for coming.